35,000 cases are reported to the CDC, but what's the threat like here in the Chicago area? Dr. John Olson is an emergency physician at Advocate Lutheran Hospital in Park Ridge, and he joins us now with some answers. Thanks for being with us.
Thank you for having me.
Well, I think people typically think of the threat posed by ticks as being like if you go into the woods, but we understand ticks are showing up in more and more places, right?
That's true. Not only in the woods, but even in your backyard, you can be exposed to Lyme disease.
And so, one of the articles that I was reading talked about how you expect it to be much worse this year than in previous years. Why would that be? Why do you think that is?
Well, I think we're having milder winters. We've got a fairly warm spring, so the ticks are out a bit earlier, and I think in higher numbers than in past years.
And what is the threat posed by these ticks? I mean, is it just Lyme disease, which we know can stick with people for a very long period of time?
Lyme's is the most common tick-borne illness. There are a number of others, but the primary one that we worry about here in Northern Illinois is Lyme disease.
Okay, so let's give people some advice on things that they can do, things that they need to watch for. It's hard to tell people don't go outdoors, don't spend time outside. So if they are going outdoors, what should they be doing? What should they bring along?
Yeah, a few simple things. Wearing long sleeve shirts and long pants. Wear something to cover your head. You want to put on some insect repellent. And there's even clothing now that is embedded with insect repellents that you can purchase and wear. You want to avoid areas that have tall grass and weeds, a lot of brush. If you're hiking on trails, for example, try to stay in the center of the trail where it's more worn, less exposure to ticks in that area. Keep your lawn mowed at home to minimize the length of the grass and weeds that you're exposed to. And then one thing I certainly recommend is doing a tick check after you go for a walk, both for yourself and for your dogs if you go for a walk. For example, my wife and I walk regularly in Northern Illinois and Wisconsin, and we have a routine where we always check the dogs and ourselves for ticks after we're finished.
And if you do find a tick on yourself or a kid, you can pick them off, you can use tweezers, but when do you have to start worrying about it? How long does that tick need to be on your body before you start worrying about whether or not maybe you could get Lyme disease?
Yeah, generally it needs to be on you for a day or two where it gets engorged. It's much more likely to transmit diseases such as Lyme's in that case. So if you see one, you do want to remove it as soon as possible, just as you described, by taking tweezers and lifting directly off your skin, removing its mouth parts.
And if it's been a couple of days, you recommend people should go to a local hospital?
If you have flu-like illnesses, or if you develop a rash at the tick bite site, then you'd certainly want to get seen by a physician or healthcare professional.
All right, something to watch for as many of us head outdoors here in the coming months. Thank you so much.